Aloha mai kako. Hello, everyone. My name is Faizah Shyanguya. I'm an MPH student in Health Policy and Management at the University of Hawaii at Manoa's Office of Public Health Studies. And so for my practicum project, I conducted an independent policy analysis relating to Hawaii's transition-aged youth. Um, and so I'd like to go ahead and provide some background about the issue. And so homelessness among transition-aged youth, or otherwise abbreviated as TAY, is a critical issue both nationally and in Hawaii. TAY are young people between the ages of 18 and 24. And those who are particularly vulnerable to becoming homeless are those who are aging out of the foster care system, although those who are aging out of foster care are just a subset of this broader group of TAY. And so my project examines the housing policy landscape for TAY in Hawaii. So I also want to provide some statistics or some numbers. So around 31,400 TAY are experiencing homelessness across the US. And so this number comes from the National Point in Time Count from January 2023. The point in time count is conducted every year on a specific night in January. And so this number usually fluctuates throughout the year. So when it was conducted this year, the numbers could have either gone higher or lower. And then also in Hawaii, we also had a point in time count. And this year in January 2024, they counted 217 TAY who are experiencing homelessness on Oahu. I don't have the numbers for neighbor islands because they conduct their own point in time count and probably publish the data within their own agencies. And then lastly, some reasons for TAY homelessness in Hawaii. And I think this is in the Oahu context, is that family disputes are usually pretty high. There's a lot of tensions. There could be disputes about their lifestyle choices. This may result in their parent or guardian kicking out the young person. Also, alcohol or substance use is an issue where they could be kicked out, or where their parent guardian is not wanting them to be inside of the home. And so usually TAY experience houselessness unsheltered, sheltered. A lot of times they're couch surfing, doubling up with other folks. So at times they can also be sort of what we call an invisible population. And so my methods of me conducting this policy analysis, I utilized Eugene Bardach's Eightfold Path. This is a guide, sort of guiding methodology for a lot of policy analysts. And so in figure 1, here I present there are 8 steps. So the first is to define the problem. The second is to assemble evidence. And so actually in my project, I did a lit review. Although it would be too much information to include in my poster, I conducted a lit review to see what policies are out there and also what types of programs are usually helpful for this population. The third is to construct the alternatives. So alternatives just mean policies or policy options. Step 4 is to select the criteria. So my criteria I selected are political feasibility, since we're dealing with policies and laws, effectiveness, how effective the policy is, equity, how equitable it is it reaching the target population I'm looking at, which is TAY, and also sustainability, how sustainable would this proposed policy or current policy or law would be in the long term. And then step 5, I project the outcomes, which I will discuss in my finding sections, but usually this is depicted in outcomes matrices. Step 6 is to confront the trade-offs, which I will discuss in my conclusion section. Step 7 is to decide and recommend, which I will discuss in my both conclusion and discussion questions. And then step 8 is to tell your story. So this could be personal stories. Just could be a general conclusion and also next steps. And so for my findings, I identified 3 policy alternatives. The current Ohana Zones program, which was passed as laws in 2018 and 2019. There is a previously introduced bill called SB 2224. This bill was actually introduced by Senator Stanley Chang, who I was interning under this past semester, and also the future Makiki Youth Housing Complex. So this is a kind of proposed policy or program that's going to be implemented in partnership or in a partnership with the city and county of Honolulu and Catholic Charities Hawaii. And so figures 2 to 4 I have here are sort of the scorings for each of the policies. And then figure 5 is the outcome matrices. So the Ohana Zones program, actually with all of the policies I looked at, I did kind of a pros and cons list, and that's how I was able to score based off of the criteria I selected. So in general, this received a score of a 4, which is pretty good. The only concern I was reading in some of the reports of this program is sustainability. There is not a lot of funding with the state because the funding has to be passed by the legislature, and also a lot of programs had to close because of it could be short staffing or just a lot of different issues with implementation. And so the TAY Special Housing Fund was proposed by Bill SB 2224 back in 2022. And so there was a audit or a report from the Office of the Auditor that kind of identified this policy to not meet special criteria to be a housing fund. And so that's why it received a score of -3. And then the Makiki Youth Housing Complex, this received a score of 5, so it was the highest score. And there is some information about I read through news articles and such, but it seems like it's a promising program. And because the city and county already has this property and they're planning to lease it to Catholic Charities Hawaii, their feasibility is looking very promising. Also, it looks like it would be effective based off of literature review. It would be a supportive housing program. It will definitely be targeted towards TAY only. And then sustainability just depends on data that's collected once this program starts. And so in conclusion, this new Makiki Youth Housing Complex received the highest score compared to others. And it would add to the housing inventory for Te on Oahu, and thus mitigating youth homelessness on this island. And so the trade-off to consider is that the bill that was introduced in 2022 prioritized the creation of this a specific funding source, which is absolutely necessary. However, uh, as I said before, the Office of the Auditor stated that the bill didn't meet that criteria at the time. However, if there was bills introduced in future sessions, it would have to be adjusted and altered to include language that would meet that criteria from the Office of the Auditor. But because it deals with funding, funding is always a necessary resource for the sustainability of housing programs. And so just keeping that in mind, reducing and preventing Te homelessness on Oahu and in Hawaii requires a multi-pronged approach. So the policy I scored as highest is not the one and only policy that will solve this problem. And so a limitation of my analysis is that I only examined it in the Oahu context. And so a recommendation for future analyses would be to consider neighbor island policies. So the neighbor islands such as Hawaii, Maui, or Maui County, Hawaii County, and Kauai County. And then also next steps would be to engage stakeholders such as TAY or the youth themselves. It could be in focus groups or kind of collecting qualitative data, as well as youth serving agencies. So there are agencies on Oahu, such as Halekipa, and there's an agency called RISE in Kailua that particularly serves as population. So talking to the staff there. And also policymakers, it can include the Senator Chang I worked under, or other senators or representatives interested in this topic, to advance state-specific housing policies. And also, it would be important to think about policies that could be introduced that cover a lot of different aspects, such as funding, and also designing housing programs in collaboration with agencies that are appropriate for young people. And then eventually that will improve their housing outcomes. And so I just like to acknowledge and mahalo my program practicum preceptor Angie for her guidance, and also mahalo nui to the Western Region Public Health Training Center for their training and financial support. Thank you all for listening to my presentation.